Hello viewers, today our video is about very interesting and common topic. The topic of our video is diabetes. What is diabetes? If you like our video, please subscribe our channel. What is diabetes? Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from your food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cell to be used for the energy. Sometimes your body doesn't make enough or any insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cell. This condition is called as diabetes. What are the different types of diabetes? The most common type of diabetes are type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes. If you have type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys the cell in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. Type 2 diabetes. If you have type 2 diabetes, your blood or your body doesn't make or use insulin well. You can develop type 2 diabetes at any stage, even during childhood. However, this type of diabetes occurs most often in middle-aged or older people. Type 2 diabetes is the most common type of diabetes. Gestational diabetes. Gestational diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you have had gestational diabetes, you have a greater chance of developing type 2 diabetes later in the life. Sometimes diabetes diagnosed during pregnancy is actually type 2 diabetes. Other types of diabetes. Less common types include monogenic diabetes, which is an inherited form of diabetes, and cystic fibrosis related diabetes. How common is diabetes? As of 2015, 30.3 million people in the United States, or 9.4% of the population, had diabetes. More than 1 in 4 of them didn't know they had the disease. Diabetes affects 1 in 4 people over the age of 65 years. About 90 to 95% of the cases in adults are type 2 diabetes. Who is more likely to develop type 2 diabetes? You are more likely to develop type 2 diabetes if you are age 45 or older, have a family history of diabetes, or are ever or overweight loss. physical inactivity, race, and certain health problems such as high blood pressure also affect your chance of developing type 2 diabetes. You are also more likely to type 2 diabetes if you have prediabetes or had gestational diabetes when you were pregnant. What health problems can people with diabetes develop? Over time, high blood glucose lead to the problems such as heart diseases, stroke, kidney diseases, eye problems, dental disease, nerve damage, foot problem. You can take steps to lower your chance of developing these diabetes related problems. Diagnosis: Type 2 diabetes is usually diagnosed using the glycated hemoglobin test (AIC). This blood test indicates your average blood sugar level for the past 2 to 3 months. Normal levels are below 5.7% and a result between 5.7 and 6.4 is considered prediabetes. An A1C level of 6.5% or higher on two separate tests means you have diabetes. Random blood sugar test. Blood sugar values are expressed in milligrams per deciliters or millimoles per liter. Regardless of when you last ate, a blood sample showing that your blood sugar level is 200 mg or higher suggested blood diabetes, especially if you have signs and symptoms of diabetes, such as frequent urination and extreme thirst. Fasting blood sugar test. A blood sample is taken after an overnight fast. A reading of less than 100 mg is normal. A level from 100 to 125 mg is considered prediabetes. If your fasting blood sugar is 126 mg or higher on two separate tests, you have diabetes. Oral glucose tolerance test. This test is less common use than other expected during pregnancy. You'll need to fast overnight and then drink a sugary liquid at the doctor's office. Blood sugar levels are tested periodically for the 2 hours. A blood sugar level less than 140 mg is normal. A reading between 140 and 199 mg indicates prediabetes. A reading between 200 mg or higher, about 2 hours, suggested diabetes. The American Diabetes Association recommended routine screening for type 2 diabetes beginning at the age of 45, especially you are overweight. If the results are normal, repeat the test every 3 years. If the results are borderline, ask your doctor when to come back to another test. Screening is also recommended for the people who are under 45 and overweight if there are other heart diseases or diabetes risk factors present, such as sedentary lifestyle or family history of type 2 diabetes, a person history of gestational diabetes or blood pressure above 140/90 mm for mercury. If you are diagnosed with diabetes, the doctor may do other tests to distinguish between type 1 and type 2 diabetes, since the two conditions often requires different treatments. After the diagnosed, A1C level needs to be checked between 2 and 4 times a year. Discuss your target A1C goal with your doctor, as it may vary depending on your age and other factors. For most people, the American Diabetes Association recommended as A1C level between 7%. An elevated A1 level may signal the need for a change in your medication, meal plan, and activity level. In addition to the A1C test, your doctor will measure your blood pressure and take blood and urine sample periodically to check your cholesterol level, thyroid function, liver function, kidney function. Regular eye and foot exams are also important.